Hi everyone, so in this video I will talk about the lower limb, specifically in the thigh compartment in this area. So um, there are three compartments in the lower limb, which are the extensors, the flexors, and the adductors. So in the lower limb, we know that our flexors are gonna be on the back. So in this part right here, this is the anterior part. This right here is gonna be our lateral part, and this right here is basically the medial part. Okay, both of these compartments right here in the back are the posterior compartments. So this is the posterior aspect of the thigh and the anterior aspect of the thigh. So the extensors, which basically extend the knee joint right here. So if you're basically extending your knee, you're straightening your leg. This is extension of the knee, right? So the extension of the knee and the flexion of the hip. Flexion of the hip is basically, so let's say this is your leg, and this, if you're looking laterally at the leg, so bringing your leg at the front, all of your leg without bending your knees, this is the flexion of the hip. So you're basically flexing your hip by bringing it in the front. So both of these actions, which is the extension of the knee, meaning, so if this is your knee, and so that's your knee, okay, so this is your knee, right? You're basically, the extension of the knee is basically bringing your leg in the front. So whatever brings it to the front, this is who's responsible for this is gonna be the anterior compartment. So bringing your whole leg in the front, including the knee, without doing anything, without bending your knee, this is flexion of the hip. You're basically flexing your muscles in the front. And what is bringing your knee from the part of the knee to the front? This is the extension at the knee joint. Okay, so that's basically from the anterior side. In the upper limb, you're basically, it's the other way around. And the reason why for this is because while developing as an embryo from week 1 to week 8, prenatal. So from week 1 to week 8, what happens is that the upper limb, it basically laterally rotate 90 degrees. So this is, let's imagine this is the our upper limbs right here. So this is the elbow, and this is, yeah, so this is the shoulders here. So what's gonna happen is that it will basically rotate laterally 90 degrees. But if we're gonna look at the lower limb, it's gonna happen in differently. So let's imagine this is the knee here, and this is the leg. It's gonna rotate medially to that side 90 degrees, and that will lead to, for the extensors of the lower limb, it will be in the front. The extensor will be in the front. Extensors of the upper limb will be in the back, right? So that's the difference between the extensor of the upper and lower limb. So back to the lower limb. So this is basically a cross section. If we're gonna take a cut right here transversely, like that. So this is axial plane. So if you're looking from the top, this is gonna be your femur bone, in the middle here, and that's basically some muscles, some big muscles of the anterior compartment and the posterior compartment. So basically that thing in green here, this is the fascia lata. So this fascia lata is basically a very deep fascia. This is superficial, and this is basically going inside in the muscles, dividing the muscles in the three compartments that you see here. So we have three compartments, as I mentioned before. This here is the anterior compartment, this here is the lateral compartment, and this here is the medial compartment. So what are the big muscles that we're having in the anterior side? As we know, the anterior side is basically our extensors. So what action it will occur, it will basically enhance, it will encourage the flexion of the hips. So the extensors are basically, so it will extend the knee and flex the hip. Okay, this is what it does for the anterior compartment. So flexion of hips and extension of the knee. Okay, so what are the big muscles that we're having here? We're having the quadriceps. This is a group of muscles, and from the name of it, it's 4 muscles. So the quadriceps are these muscles here. So this is basically the lateral side, and this is the medial side, like I just mentioned. Okay, so right here is vastus lateralis. This is vastus medialis, and this is intermediate vascularis, and the top here is rectus femoris. Okay, so those are the first 4 muscles here, 1, 2, 3, 4, and they are called, this is a group of big muscles, it's called quadriceps. And then you have this muscle right here in the medial side of the anterior compartment, which is called sartomus. Okay, and then there are other muscles that are really important. So these muscles are mainly for the extension of the knee. There are some other muscles in the anterior compartment that's basically enhancing the flexion of the hips. And these muscles are the iliacus muscle. So these muscles are iliacus muscle. So iliacus muscle, this is a one, and the other one is basically psoas major. These two are basically they are mainly for the hip flexion, and they are in the anterior compartment as well. So all of the anterior compartment is mainly supplied by femoral nerve. This is the main supplier in the anterior compartment. It supplies all of the muscles except for psoas major, which is basically supplied directly from the lumbar plexus. So we know that the lower limb, who's responsible for the lower limb supplying what is the plexus? It's basically from the lumbar side. The lower lumbar segments are responsible for all of the lower limb, plus the sacral as well, the sacral segments. And mostly they are from, so we having L4, L5, S1, S2, S3. These are the main ones that are basically supplying the upper limb. So we're done with the anterior compartment. We're gonna go to the posterior compartment, which is divided into 2 compartments: the lateral, which is pointing to the outside, and the medial, which is pointing to the inside, right? So the lateral compartment, it's called the flexor compartment. Why is it the flexor compartment? Because so whatever you're having, flexor, extensor, it's according to the knee joint, okay? So it's flexing the knee joint, flexing knee joint. Okay, so imagine that your leg is straight So what you're gonna do, you're basically gonna only move from the knee to right here. You're not gonna move the whole leg, you're gonna move only the lower part of the leg. So you're gonna move from the knee up to the up. This is flexion. This is flexion. And the compartment that's, so it's common sense. Imagine that there is the muscle here that's responsible for that, right? So it has to be the posterior muscle, the posterior side of the leg that's responsible for that. On the upper limb, it's different from this. You're basically gonna have it in the front. The flexing of elbow is in the front, which is biceps. This is the most common one, the most famous one. So right here, flexor, you're talking according to the knee joint. So you're basically flexing the knee joint, and you are extending the hip joint. So what is extension of the hip joint? You're basically bringing all of your leg to the back. Okay, so right now, what are the major muscles that we're talking about here? So the first one is the biceps, and as we're having biceps in the arm, we're having biceps also at the leg. So that one is basically called biceps femoris. In the upper limb, it's called biceps brachii. Okay, all right, so biceps femoris, this is our first one. This one right here is called tendinosus, and this one is membranous. Okay, so these are basically they are mainly for flexion of the knee joint. And who's responsible for this? What is the nerve that is basically supplying the flexion compartment? Is sciatic nerve. This is the main nerve and it's very, very big. It's very, very big, and it's very, very thick. The thickest and the largest nerve in the lower limb. So, and I guess it's in the whole body as well, because it's really thick, supplies big muscles. So, and flexion is really a tough it's a really tough job if you're talking about the leg itself. It's a huge muscle. So it supports those three main muscles. And lastly, we're gonna have our posterior compartment, the medial part. So the medial part, it's called adductor. So what is adductor? So imagine if someone is facing you like here. So this is the knee, this is the leg. Imagine that the whole leg, and there is another leg here. Okay, there is another leg here. So imagine that. So adductor means you're basically bringing your leg to the inner side. Okay, so this is adductor, you're adding. So this compartment is called the adductor compartment. Right here you have the adductor longus, and right here you have the adductor magnus. So in the adductor magnus, it's interesting because it has a posterior part right here, which is basically contributing in the adduction, and it basically have also the anterior part, the superior part of it. It's basically, so it has inferior part and it has superior part. So superior part is basically responsible, it's contributing in the flexors compartment as well. So it has two jobs. It has the flexion and it has also adduction as well. So this is one, and right here you have gracilis. So these are the muscles that are responsible for the adduction, and the nerves. There are a couple of nerves that are basically responsible for these. The main one is the obturator nerve. That's it.